Good afternoon. We'll now start. We'll now start the pep talk. I'd like to welcome everybody to this pep talk this afternoon. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk. So please show your faces in the video. A reminder after the pep talk, please take the online learning cum evaluation test exercise for mastery of learning and have a perfect score to get a certificate like the one shown on the slide. The link has been placed in the chat box. Another reminder, 50 OLETE certificates will entitle one mentee to a voucher for a free ROJoson telemedical consultation, like the one shown here in the slide. Let's now have a group picture taking before we start the pep talk proper in 2 minutes. Please turn on your video, show your beautiful faces. Ready? 1, 2, 3. Oh, wala. Okay. Ulit. 1, 2, 3. I have a patient empowerment program in which I like to empower lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. From October 23, 2021 onwards, I have been tackling health disorder and health issue courses. This may take 3 years or longer depending on our enthusiasm and perseverance. My pep talk today is entitled Rabies Awareness. This is in consonance with the DOH or Department of Health Awareness Calendar. March has been declared as the Rabies Awareness Month. The empowerment objective is for the lay people to have a basic understanding of rabies in their health management. The contents of this particular pep talk will be the following. Why the Rabies Awareness Month? What is the Philippine government program against rabies? What is a rabies? What is the prognosis of rabies? What are the preventive measures against rabies? How can one contribute to zero rabies death in the Philippines by the year 2030? And what are ROJoson's health advice on prevention of rabies on a personal level? First topic, why the Rabies Awareness Month? This has been declared. March has been declared as the Rabies Awareness Month to raise awareness on rabies as a health problem in the community, as well as in our personal life, and also to highlight the importance of managing rabies in the community. Number 1, because it's common. Number 2, it's causing a lot of death. And then number 3, it's preventable and beatable if only every citizen is empowered and will cooperate. This slide shows the statistics on the animal bite cases from 2007 to 2018. So you can see the trend is going up. as of 2016 up to the present, there have been more than 1 million cases of animal bites reported to the Department of Health. And then in this slides also show some statistics on the frequency of bites from the animals. Majority are bites from dogs and cats. And then the rabies cases usually come mostly from dog bites. And 72% of the rabies cases are owned by people. And then 88% of rabies cases were either freely roaming along the street and occasionally roaming. Rabies is a viral zoonotic disease. When you say zoonotic, it's transmitted from animals to human that cause 59,000 deaths every year worldwide, with majority 56% of the cases occurring in Asia. In the Philippines, there are reported an average of 250 to 300 deaths every year, mostly among children below 15 years of age, and usually those coming from poor families. So rabies kills. Rabies is a fatal disease, as 99 to 100% are fatal, deadly, once you have symptoms of rabies already. At the moment, there are no specific treatment available anywhere in the world. So that's why we caution everybody, and we want everybody to be made aware that rabies kills. We also want to make people aware that rabies is preventable, 100% preventable and beatable. Beatable, that's why there is a program, there is a campaign for rabies to be zero in incidence or death caused by rabies by the year 2030. So this is a campaign not only by the WHO, World Health Organization, but also in the Philippines. The challenges in the rabies problem will be the following. Even though such deaths are preventable, we said it's 100% preventable, there is no treatment or cure for rabies once the clinical manifestation of rabies set in. Pag lumabas na yung symptoms ng rabies, usually dead ball na yung pasyente. Number two, the challenge would be the high cost of anti-rabies vaccine and immunoglobulin. So these are the medicine usually given to patients with animal bites to prevent rabies. The high expenditure for the medical consultation is another challenge, and also the loss of income from the family are additional burden to a regular Filipino family. The third challenge is that the victims of potentially rabies bites suffer anxiety resulting from uncertainty on the consequence of rabies exposure. So pag nakagat tayo ng aso, hindi natin malaman to magkaka-rabies tayo. So this is the anxiety of all patients or all people who have been bitten by an animal. What is the government doing on the rabies problem? It has enacted the Anti-Rabies Act in 2007. It has created and implemented the National Rabies Prevention and Control Program, from not only from the national level, but up to the LGU level. And it has also established a lot of animal bites treatment centers. As of 2018, it has already 613 animal bite centers throughout the Philippines. I think more will be coming. And then the program for the rabies will include the following: mass vaccination of dogs, dog population management, health promotion, advocacy on responsible pet ownership, establishment of central database system for dogs, provision of pre-exposure prophylaxis for high-risk individuals, and lastly, provision for post-exposure prophylaxis after an exposure from potentially rabid animals. So these are the activities, the projects under this national program for anti-rabies. And then what is the government doing? It has, as of 2020, it has come out with a strategic plan that will cover the years 2020 to 2025, and the overall and ultimate goal of declaring the Philippines rabies-free by the year 2030. This is in consonance with the target of the World Health Organization. And then to be able to achieve the rabies-free by the year 2030, it has targeted 3 years earlier to end all the human death, yung mga taong namamatay from dog-mediated rabies, yung mga kinakagat mga aso. So, in the strategic planning program, it tried to strengthen the national program that were mentioned earlier. So these were the programs, okay, that I listed down, the same programs, okay, but it just want to strengthen it up to 2030. So the main question is, how can we help? How can you help in this national program? So one of the components of the program is health promotion. It celebrates the Rabies Awareness Month every March of each year. And it's there's a so-called World Rabies Day, with September 28th being declared as the day. This is worldwide. And then there is development of information, education, and communication materials for the public. There's a massive health information campaign using the tri-media, and there's an integration of rabies program into the school curriculum. Because as we know, there are a lot of children being bitten by rabies. So how can we help? How can you help? Number one, be empowered with the 4 Ks: kaalaman, kakayanan, karapatan, and kapangyarihan. And also empower other people, especially the children and the poor. As to the dog vaccination, as we know, this is the most effective measure to control canine rabies or rabies from dogs. The Department of Agriculture, Bureau of Animal Industry usually is the lead agency in the mass dog vaccination campaigns and provision of animal rabies vaccines. So how can we help? So vaccinate your dogs and cats if you have at home. Help in the dog vaccination program within your home or outside or in your community. Help the other families or other people in your community. Dog population management. So this will include the stray dog management, yung mga gala-gala ng mga aso. So through impounding, field control and disposal, surgical and non-surgical sterilization and habitat control. So how can we help? So report to community leaders on any of the stray dogs roaming around in the community. Assist in the stray dog management. Responsible pet ownership, especially if you have dogs or cats. So this program adopts a strategy of promoting responsible pet ownership to prevent the spread of rabies. The public is advised to bring their pet dogs for anti-rabies vaccination when they reach 3 months of age yearly. So taon-taon. Thereafter, provide proper nutrition, exercise, and shelter to their pet dogs, and not to allow their pet dogs to roam around to prevent the contact with infected animals. I like to emphasize here, probably most of us might not know it, there's a law that penalizes owners of stray dog. If somebody got bitten by stray dog, the owner will be liable for the expenses or even for the death of the person being bitten. Animal bite centers or animal bite clinics. The animal bite treatment centers were created by the Department of Health starting 1997. Initially, there's a difference between the bite centers. The government usually call it animal bite treatment centers, and the private ones, they usually call it animal bite centers. But nowadays, the two names are interchangeable. So there are a lot of, as I said in my earlier presentation, there were about more than 600 animal bite centers created by the DOH by the year 2018. As of now, there are more coming up, especially the private hospitals, and also the clinic-based animal bite centers are becoming more, has increased in number. So if you search the Facebook, the internet, you're going to see a lot of private animal bite centers advertising, especially this month, because of the month being declared as Animal Bite Rabies Anti-Rabies Awareness Month. What is rabies? Rabies is a dangerous viral animal infection and a fatal disease, as mentioned, with no specific treatment available everywhere in the world. Once rabies develops, there is nothing that can be done anymore. The signs and symptoms of rabies for us to be aware of will be the foremost indicator for rabies setting in is the hydrophobia, meaning the fear of water, presence of fever, malaise and headache, intolerance to noise, bright light or air, and irritability and hyperactivity. There are two types of rabies, the furious type and the other one is paralytic type, but the more common one is the furious type. So we have to prevent rabies at all costs because rabies kills. Here are some recommendations on personal prevention. Have your pets, particularly dogs and cats, vaccinated against rabies. Be vigilant against the licking, the scratching, and being bitten by dogs and cats whose vaccination status is not known to you. Once exposed, meaning lick, scratch, or bitten, to dogs and cats, particularly whose anti-rabies vaccination is not known. So the first thing to do right away is to wash the wound immediately and thoroughly with soap and water for at least 15 minutes using running water. Go to an animal bite center or emergency room as soon as possible. Then, while you're doing this, observe the involved animals for 14 days. If there is a presence of signs and symptoms or death of the animals, report it right away to authority because a lab exams for rabies has to be done. So this infographic will just illustrate what is recommended earlier. Immediately wash the wounds with soap and water for at least 15 minutes with running water. An option will be to disinfect the wound with alcohol or iodine solution if possible. If it's not possible, it's enough that you have washed it with running water for at least 15 minutes. Then immediately consult the doctor or go to a nearest health facility. What is an animal bite center or treatment center? It's a facility where you can avail of services about animal bites. These clinics may be attached to a hospital or as a separate center or standalone clinic. So these centers have available vaccines and injection shots specially made to prevent rabies symptoms and infections. The World Health Organization has come out with guidelines on the so-called post-exposure prophylaxis or PEP, and also on the pre-exposure prophylaxis. This is just a note on the pre-exposure prophylaxis. This is being done before exposure to the animal bites. and then given to people at high risk of exposure to rabies or animal bites, such as the veterinarians and those handling animals. Then the post-exposure prophylaxis is the emergency response to rabies exposure. After a person has been bitten, so you now have the so-called post-exposure prophylaxis. So this post-exposure prophylaxis prevent the virus from entering the central nervous system, which would invariably result to death. Pag pumasok na sa utak, sa central nervous system, usually patay na yung pasyente. As we said, rabies is fatal. WHO, it has recommended the following post-exposure prophylaxis. Number one, it's still the most important immediate thing to do will be extensive washing with soap and water for at least 15 minutes, and then local treatment of the wound as soon as possible after a suspected exposure. And then a course of potent and effective anti-rabies vaccines that meets WHO standards. Usually WHO will tell us which rabies should be used. And number three, administration of rabies immunoglobulin, usually injected into the wound. If there's a wound there, a fresh wound, then rabies immunoglobulin has to be injected into it. Kung may wound. Okay? It also has a proposed the following categorization of animal bites, the so-called risk assessment of exposure to rabies. It has three categories. Category 1, strictly speaking, there's no exposure because it just involved touching or feeding animals, okay, animal leaks on intact skin for those with dogs with possible rabies, but no wound, okay, just touching. And then category 2, this is the time that we said that there is exposure to the possible rabies. So there's nibbling of uncovered skin. Sabi natin may damit, okay? So minor scratches or abrasions but without bleeding. And category 3, this is the most severe exposure. So it can consist of single or multiple transdermal or skin bites and scratches, contamination of mucous membrane or broken skin with saliva from animal leaks, and exposure to direct contact with bats, yung mga panikit. No? Okay. So 1, 2, 3, yung 1, no exposure, 2, exposure, mild lang, and the category 3, severe exposure. So based on these categories of exposure to the animal bites with possible rabies, the post-exposure prophylaxis measures will include the following. For category 1, you just wash the exposed skin surface, no prophylaxis needed. But for the category 2, beside the wound washing, you have to do immediate vaccination with anti-rabies. And then category 3, wound washing, immediate vaccination, and administration of rabies immunoglobulin through the wounds of the skin, on the skin. So the schedule of vaccine shots will depend on the recommendation of the doctor doing the risk assessment of the wounds. In most cases, the counting will include day 1 or day 0, then day 3, day 7, day 14, and 28 days. This is the usual schedule, but it can vary depending on the assessment and decision of the doctor. So an important thing to remember, there's a need to complete the number of shots to make the vaccine effective. As to the number of shots, as I said, it varies. A minimum of 3 shots may be given by a doctor depending on the patient's condition. If you had a vaccination before, the doctor may decide to give you a shorter course. Instead of 7 or 5, it can be just 3 or even 2. Vaccination usually used in patients with animal bites. So there are usually 2 types of vaccination. One is against the rabies itself. The other one is against tetanus. So the anti-rabies vaccines will include the following. You have the cell culture vaccines, and then the equine rabies immunoglobulin, and the human rabies immunoglobulin. And then against tetanus, you have the tetanus toxoid and the immunoglobulin, which could either be human and equine. So take note, the human sources, such as human rabies immunoglobulin and human anti-tetanus immunoglobulin, are more expensive, or very expensive. And then among the different vaccines, there are different brands with different costs. So one just have to choose which one is probably which one is available and which one is more cheap. Okay, but what's more important to remember, whatever is used, it must be certified by WHO and the BFAD as acceptable. There are two types of vaccination using the anti-rabies vaccine. One is the intramuscular to the muscle, and one is intradermal, just into the skin. For the intramuscular injection, usually deltoid muscles do sa arm. Okay? And kung di magagawa doon sa arm, they put it on the thigh, anterolateral thigh. So for the deltoid, it's usually done for adults and children, but for the infants and small children, usually anterolateral thigh is sa hita. Okay, so a note here, injection through the buttocks or gluteal region is usually not recommended. So this is an illustration of the intramuscular derecho to the muscle. This one intradermal, more superficial, just into the skin. Okay. And then this is an illustration of the immunoglobulin being injected around the wounds of the animal bites. Okay. So kung walang bites, they just inject this immunoglobulin it's either intradermal or intramuscular. But if there are bites, open wounds, the immunoglobulin is injected around the wound. Cost of the anti-rabies vaccinations, remember, it's free in the government institutions, but in the private institutions, it may be as high as 10,000 per session and as high as 50,000 for the complete set of vaccinations. As I said, there could be a series of vaccination that has to be done. Now, for the standalone clinics, usually these are cheaper than the hospital-based animal bite centers. And then a word about the difference in cost in the intradermal and the intramuscular. Usually the intradermal vaccinations are cheaper than the intramuscular. And usually the intramuscular administration is usually done by, or the intradermal administration is usually recommended in government institution because this is being recommended by WHO. But both of these types of administrations are available in the private facilities. So the choice will just be advised by the doctor or even with the consent by the patient, whatever they want to have. Okay. So this just shows some quotations from private private animal bite centers, which might give you an idea where to go. Okay. So I have asked these quotations from the private animal bite centers. For anti-rabies, 700 pesos per session times 4 sessions. Then tetanus, 150 per sessions times 3 sessions. And then the equine rabies immunoglobulin, usually 1,700 base price, once only. Okay. And this, as I said, this is only given to patients with category 3. Now, for the intradermal vaccination, 700 per dose times 4, so that's about 2,800. But the intramuscular, it's, as I said, it's more expensive, 1,400 times 4 or 5 doses. Then the tetanus toxoid, 150 pesos per dose, and the ERIC will be 150, more or less the same here. Okay? So as I said, all the cost would be dependent on the brand also, and also on the whether it's a hospital-based or standalone clinics. So it's more expensive in the hospital-based annual bite centers. So these are the frequently asked questions. How long are you immune to rabies after vaccination? The rabies vaccine does not provide lifelong protection. Remember that. Okay. Then a frequently asked question is, should I take vaccine again after after vaccination and after being bitten by a dog again? So if it's within 3 months, then you don't have to do the anti-rabies vaccination anymore. Only wound treatment if you are bitten again after 3 months or within 3 months. But after 3 months, then aside from the wound cleaning, you may need to take booster for day 0 and day 3. Mas maikli lang. So is there a single dose of rabies vaccine that is available? No. Palaging may series yan. At least 2 or 3 or sometimes even up to 5. Some would shorten it to about 4 depending on the schedule. So as I said, intramuscular injection can be done as well as intradermal, but the WHO usually recommend the intradermal because it's most cheaper cost than dose and then time sparing. You can shorten it to about 3 doses. Okay, 2 doses administered in day 0, 3, and 7. Mas mahikli ang series. No? Okay. So summary and takeaway. I have presented the following topics: rabies, why the Rabies Awareness Month, what is the Philippine government program against rabies, what is rabies, what is the prognosis, preventive measures, how one can contribute to the zero rabies death in the Philippines by the year 2030, and then what are my health advice on the prevention of rabies on a personal level. Takeaway in relation to patient empowerment: be always in touch with reliable medical information on rabies. Knowledge is power. It gives power. Use the 4 Ks of patient empowerment: kalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions in the prevention of rabies in one's health management. So with that, I end my pep talk, rabies awareness. I hope I have empowered you to have a basic understanding, a better understanding of rabies in your health management. Before we go to the QA, question and answer portion, remember, after the pep talk, take the olete. 50 olete certificates will entitle one to a voucher for a free ROJoson telemedical consultation. And feedback, please place your feedback in the chat box during the open forum and before we adjourn. Let's now have a group picture taking before we go to the question and answer portion. Okay. Everybody's ready? Okay, 1, 2, 1, 2, 3. Okay. So the floor is now open for questions, comments, sharing of experience. How many have pet dogs at home? How many of you have pet dogs? 1, 2, 3. Okay. I suppose all your pet dogs have been vaccinated already. Lahat? Okay, so make sure it's being vaccinated, huh? about cats. May cats? Ba? Si Perla, may cat and dogs, no? Okay. Hindi nag-aaway. Okay. So, yung cats nyo, vaccinated din? Perla?
Ano, doktor? Na-vaccinated na po, pero parang ano na eh, February 23 pa eh.
Oh, may
Oo.
vaccination booklet ka pa.
Last
Good.
year. Oh, meron niya siyang vaccination book.
Good.
Pero nag-lapse na eh. Dapat mabaksina siya nung ano, February 23.
Okay. So, every year ang vaccination, di ba?
Opo.
Yeah. Magkano yung vaccination sa cat, saka sa dog? Can you share?
Libre, doktor, kasi nag-ikot yung taga-munisipyo.
Okay. So, libre, no? Okay.
Opo.
Good. Libre. So, pero sa private,
hindi ko lang alam,
gastos,
doktor.
no? So, kung sa government, may waiting time, no?
Oh, libre. Pag pumunta sila sa barangay nyo or pupunta ka sa clinic nila po.
Yeah. Okay. So, I don't know kung matagal ang waiting time. No? Okay.
Opo.
Okay. Any experience with relatives being bitten by the dogs in your house?
Doktor.
Perla?
Opo. Kasi naano ako ng pusa ko, na-scratch lang naman, doktor. Scratch lang, pero bakit nung pumunta ako sa bite center, 5 beses ako bumalik, parang ang liit-liit naman yung ng pusa ko, yung parang na-scratch lang.
Yeah. Iba-iba kasi, no?
Yeah.
So it all depends on the doctor's assessment.
Opo.
No? Iba-iba. So that's why we want
the same
to empower
experience.
You. We want to empower
5 beses ako bumalik.
Ano ha?
Kahit parang hindi nga mahalata na na-scratch lang eh. Parang ang liit-liit. Pero takot ako, pumunta talaga ako sa animal bite sa aming ospital. Eh yun nga, 5 beses akong bumalik-balik. Ang mahal pa ng bayad.
Private ito?
Opo, private.
Okay. Pero at least mas mura yan kaysa sa hospital base, no?
Sa isang session, doctor, is 1.3. Discounted na kasi senior.
Senior yung aso? Senior.
Ako, senior, doktor. Kasi 1.3 na, discounted na yun kasi senior daw ako. Sabi ko, 1.3 discounted na yun. Ang mahal-mahal naman, 5 beses akong bumalik, sabi ko.
1.3? Ano ito? Yung mga, depende sa okay.
Hindi ko nga mahanap yung libro ko kasi hinahanap ko nga para sabihin ko nga sana, hindi ko lang mahanap kasi meron akong booklet na binigay eh. Opo.
Okay. So, 1.3 because of your senior, pero usually mga 2,000 yan eh. No? Okay, yung vaccination na yan. No? Okay.
Opo.
Okay.
Opo.
Thank you for sharing. Chuchi, you're about to say something, Chuchi?
Yeah. Yes. I had the same experience. Pusa lang din yung naka-scratch. Na-scratch lang ako because I was entering the clinic of I was running an errand for somebody, and so I tried to enter a clinic, buti na lang clinic of one homeowners association, and then there was a cat in the middle of the entrance door, so I kicked the cat. I mean, I was shooing the cat away. Ayaw mag-budge. So I sort of kicked a little bit lang. Ini-scratch ako with the paw, just the paw. But there was a wound, and I don't remember any blood coming out, but there was a wound. So when I was able to enter the door, the nurse asked me if I have any wound, kasi nakita niya na ini-scratch ako nung cat. And I said, I think so, but I was really, I didn't know that, I didn't feel anything. So sabi ko, it's okay. No, it's not okay. Let me nurse yung nag-attend sa akin. Let me clean the scratch. So she applied right away alcohol and ewan ko kung ano pa yung in-apply niya. And I thought she was overreacting. Parang pareho kami ni Perla ng impression, no? But then at hindsight, sabi ko, naku, buti na lang, ganun ang ginawa ng nurse because she probably knew what she was doing, no? I was oblivious, hindi ko alam kung ano yun. Sabi ko, hindi naman kailangan kasi cat naman. Akala ko mga dogs lang ang may rabies. Tapos, it didn't end there. Sabi pa niya, she was a very responsible nurse. Sabi pa niya, ma'am, you have to go to either a hospital or an animal bite center, or go to your city hall. I'm sure there is one in Pasig because I live in Pasig. So, she was the one who told me, if you go to a city hall, it will be libre, or they will make you pay a little bit lang, which is what happened. Halos libre na. Parang I remember having paid 600 pesos or something like that. Maybe just for the cost of the medicine. And they made me go back 3 times for that. And I mean, now, after hearing after the session, I'm very, very thankful na ganun pala talaga. It's very dangerous to have scratches or wounds inflicted by animals, no? And in fact, I have a neighbor. This is another experience. I have a neighbor whose PWD daughter was just playing in the park, in our village park, and she got bitten by a dog, malaki. And so I will show her the YouTube. I will ask her to take a look at this YouTube because it happened only 2 weeks ago.
Oh, okay.
I don't know what she did after that.
Okay.
So, para it will not be too late, no? Baka mamaya.
So make sure, ano, start 2 weeks na, no? Make sure
2
the
weeks.
status of the animal also, na
Yes.
kung stray dog, wala na, hindi mo mahabol, di ba?
Hindi stray dog. I'm sure may injection yung animal.
So, kung may
because it also belong to another neighbor. I didn't know before na it was really that dangerous, no? That I mean,
all of us,
walang treatment, you just die.
walang treatment up to now, no? Okay. But it's something preventable, no? Ingat lang,
Yes.
no? Okay, thank you for sharing.
Thank you too.
So you had vaccination, three injections.
Yes.
Okay.
Tatlo. I don't remember kung ano yun. I just listened to the doctor.
So at least category, it's supposed to be under category 2, no? Category 2 may scratch, no? May wound, no? Okay. So ganon din nangyari sa akin about 3 months ago, ganon. I was also scratched by a cat, no? And then, ginawa ko na lang, just remember, wash it right away. So, i-wash ko lang, sa daliri ko lang na-scratch, no? So, I wash it right away, no? Then, I just pray that I won't have any rabies. Kasi yung cat naman is relatively clean, no? So, I just wash it every day. Then, so, I didn't go for vaccination na lang, no? Pero kung minsan, akatakot talaga, you don't know the status, no? That's why whenever you go to a animal bite clinic, sigurado iba-vaccinate ka because nobody is certain what will happen, no? Okay. So, pero on our part, we make a decision. Should we go for kasi the moment you enter a vaccination clinic, no doctors will say, hindi mo kailangan vaccination, especially kung meron kang wound, di ba?
Okay.
Kung walang wood, okay lang.
I remember what she said. Sabi niya, I remember now what the nurse said. Kung yung cat is a stray cat, kasi it was a stray cat, hindi nila alam kung saan-saan lang yun nanggaling, no? If it were a pet, maybe she would not she would not make me take three injections, but it was a stray cat.
Stray cat.
Hindi raw nila kilala yon kung saan-saan lang daw nakaano yun.
So usually yan ang isang anxiety natin, no? Once we get bitten by some dogs, no? If we don't know the status of the vaccination, yan, takot na tayo. Baka tayo magkaroon ng rabies, di ba? So tendency is to go to an animal bite center, no? To have yourself treated. And then if it's category 2, siguradong lahat ng doctors will tell you, magpa-vaccinate ka na. Di ba? Okay. So it's a hassle. You have to go back at least 3 times, no? Kung saan 5 times pa. And then also the cost, ang mahal, no?
Yes.
So this is the first time I'm giving a lecture on anti-rabies. It's an eye-opener also for me, and also to tell you para meron kayong options, no, where to go, no? I'm happy to see that there are a lot of private animal bite centers coming up. Kasi dati it's hard to get into a government animal bite center. Kulang. Number 2, may mga hospital putting up animal bite centers pero masyadong mahal, no? Masyadong mahal, no? So nowadays you can see if you search the Facebook, no? Ang daming animal bite centers coming up. Kung saan may mga 24-hour service pa sila ngayon, no? Okay.
Right.
Yeah.
I also remember pala, because I'm a hospital volunteer, remember?
Yeah.
So, there are many cases ng mga animal bites sa emergency. And actually, I volunteer kasi sa DOH Hospital, Rizal Medical Center. They don't have enough vaccines. For some reason, they ask the patient or whoever got bitten by the dog to go out and buy their own vaccine. And so our foundation usually we help in their purchase of the medicines, but I don't remember the amount anymore.
Yeah. A lot of hospitals do not carry yung mga vaccines also, no? Okay.
Oh, they don't have it pala. I mean, it's not guaranteed that if you go to a government hospital na you will be treated right away. I mean, you will be injected right away. They'll probably give you the first aid. They will clean it up.
Yeah. During the pandemic,
but
I've
they cannot.
one patient.
No guarantee that they will.
Mahal kasi.
Mahal.
So a lot of inconvenience, hassle, no? Okay. So the lesson here, as much as possible, avoid being bitten by any animals.
Or even scratched.
Even scratched, no? Okay. Or make sure when you have a pet at home, make sure vaccinated na siya. Okay. Kung minsan, you cannot avoid petting the dog, di ba? The cat or the dog. Kung minsan kakagating ka, di ba? You cannot avoid that, no? Okay. I have one patient during pandemic, ganun din no? So she has to ask me kung saan through telemedical consultation, saan pwedeng makakuha ng gamot? Kasi she went to the animal bite center, walang gamot, no?
Yes.
Sabi ko, you have to go to another center na lang. He's financially disadvantaged. Sabi niya, hindi ko kaya kasi mga private hospital In which case, sabi ko, you just have to wait, no, for the next dose, no, and then I don't know what happened now, no. So
City Hall would be better. The City Hall, especially if it's a big city like Pasig, there was a long line in Pasig City because mayaman ng Pasig marami silang funds sa animal bite center nila. So, I mean, that's a tip for some of you who might encounter a similar experience. Alam ko sa Pasig, I didn't have any difficulty.
Yeah. So probably another recommendation is to keep a parang list of animal centers nearby para ready ka where to go, di ba? Okay.
Yeah.
So keep track, no? Kasi emergency yun di ba? So kung maghahanap ka pa lang, no, baka mahirapan ka, you'll be forced to go to a private hospital, no? Ang mahal-mahal, no? Okay.
Within
Tama,
how
Sir.
many, excuse me, Doc, within how many hours after the bite?
As soon as possible, but if it's mga 1 day, pag 1 day, 2 days, mas delikado na, but you still go through the vaccination, no?
Oo.
Okay. Usually, I think if I recall right, pag more than 7 days na, pwedeng hindi na. But before 7 days, you still undergo the vaccination, no? Ganon. Okay. Thank you for
Okay,
sharing.
thank
Chi. So, any
Doktor,
more?
ask ko lang, doktor.
Ah,
Pag
Pardon?
nabakunahan na ba yung mga pets namin, pag nakakagat, wala nang rabies yon?
Walang?
Wala nang rabies sa kanila?
Saan?
Halimbawa, ako nabakunahan na anti-rabies, pag nakagat ako, wala nang rabies yon?
Pag nakagat ka?
Opo. Pag nabakunahan na yung mga alaga ng mga anti-rabies, di ba doktor, na bakunahan na sila, vaccinated sila, pag nakakagat sila o na-scratch, yun, wala nang rabies sa katawan mo, hindi ka na magpapa-inject, magpapabakuna.
Hindi. As I said, one of the questions that I post here in my lecture is that there's no lifelong protection, no? Walang indefinite na protection, no? Kaya yung mga aso nire-recommend na once a year, yearly, di ba, bina-vaccinate, no?
Opo.
Okay. Tayo naman kung nakagat, no? As much as possible, huwag, no? But let's say nakagat ka within 3 months, pwedeng wala. 3 months lang, ha? Kung nakagat ka ulit, no? Kasi may protection ka pa, no? But after 3 months, usually, binibigyan ka mga booster shots, no? Okay? Yung mga veterinarian, mga doctors, saka staff, no, they're frequently exposed to animal bites, no? So, ang recommendation is yung standard recommendations every 3 years. Pero dito sa Pilipinas, ang nakausap ko isang vet med, no? Sabi nila once a year, yearly sila nagpapa-vaccinate, no? So ibig sabihin, walang total immunity from developing rabies again, no? Okay. Okay. Any more questions? Okay, Chuchi.
No, but you are assuming that the pet owner is responsible enough to have a yearly or every 3 years. I mean, if I were the mother of whoever is bitten by the dog, I would rather go to the through the process, no? O kasi hindi naman tayo sigurado na ito ho, na-injectionan ho itong aso na to. Yung pala, na-injection na 6 years ago na. Diba? I mean, you'll never know.
Yeah.
I think that's the question of Perla. Diba, Perla?
Opo.
Yeah.
Oo.
Pag alam mo na,
once vaccinated yung alaga mo, halimbawa, nabaksinan yung alaga ko, nakakagat siya ngayon, hindi ba siya makaka-inflict ng rabies doon sa nakagat niya? Since vaccinated na po siya na anti-rabies.
Yun na nga. The answer is, sana every year or at least every 3 years. Supposing nakalimutan natin, do we keep track of the vaccination of our pets? Ako, I honestly, I'm very, very scared of dogs. So I don't have dogs. But my children love dogs. So I stay away from the dogs. Sila, But now that after the lecture, I will show this to my children so that they will know. They have to
Yeah.
be responsible owners.
Yeah.
They have to keep track of the vaccination of their pets.
Yeah.
Yung isa, dog lover. Yung isa, cat lover. Sabi ko, I'm neither. I don't like them.
Yeah.
But
Tama.
I have to,
So once a year,
rate
it's
them.
once a year vaccination. Okay? So kung minsan, hindi mo rin ma-assure na free from rabies kasi sabi mo, kinukulong mo lang sa bahay, hindi naka-expose sa iba, no? Mahirap din
Yes.
i-guarantee yun, no? So just have the vaccination for the dogs every year na lang, no? Okay. So any more questions? Before we call it today, it's 3 o'clock, no?
Meron akong itatanong, Doktor.
Sure.
Kasi nung nagpabakuna ako, nung galimbawa nagpabakuna ako, tinuturukan ako ng anti-tetano, ba yun? Nung naturukan ng last September 8, naturukan ako ng anti-tetano. Sabi ng doktor po, magpabakuna ka ng anti-tetano sa January 8 at saka sa June 8 kasi lifetime na daw yun. Totoo ba yung doktor? Halimbawa, nagpaturok ako nung January 8. Sa June 8 magpapaturok ako ulit. Lifetime na ba yun na ako ng tetanus?
Hindi rin lifetime yon. Usually, merong recommendation every 5 years or 10 years, no? Ganon, no? Merong would recommend every 5 years ang bakuna, no? Okay. Kung kasi yung toxoid, just like the vaccine, series yon tatlo, no? Ang injection, no? Yung isa, immunoglobulin, isa lang, no? So, kaya may pinapabalik ka for another dose, 3 doses, tatlo yon, no? Okay. So, pero it's not a lifelong immunity, no? Okay. So, if you really want to be protected from tetanus, at least every 5 years, no? Kung meron kang bakuna in less than 5 years, pwedeng hindi nabigyan ng no? Yung tetanus injection anymore, no? Pero dekahon na yun. Once you're bitten by the dogs, no, by the cat, bibigyan ka na ng anti-tetanus. Dekahon na yun, no? Okay. Okay? Kaya napapamahal nga, no? To be bitten by a dog or an animal, no? So ingat na lang tayong lahat, no? Okay? So if there are no more questions, I hope we have learned something, okay, from today's lecture. Number 1 lesson is try to not to be bitten by any dog, any animals. That's the first thing. Now, if you have pet dogs, no, pet cats, no, have them vaccinated, okay, as soon as possible and maintain the vaccination. No? Then if you are bitten, go have a list of animal bite centers in your house so that you parang emergency numbers, no? So you know where to go right away, no? At i-ano na lang ninyo sa Facebook, marami. I tried it, no? You can ask for the prices already, no? So if let's say you have identified a animal bite center na private near your area, no? Kunin na niyo yung quotations, no? Para alam niyo how much you're gonna spend, no? Okay?
Opo.
So with that, we'll call it a day. Okay? Okay, lahat. So next week, we will have another lecture will be digestive health, na awareness, na digestive, na sa tiyan naman, na. Okay?
Okay, Doc.
Okay.
Okay, Doc.
Thank
Thank
you.
you.
Bye.
Bye-bye.
Thank you po. Bye.
Bye-bye.
Bye.
Bye.
Thanks for the lecture.
Sino si Oppo? Abet, sino si Oppo?
Baby.
Ha?
Baby.
Okay.
Ano mo na nga, patay mo na nga.
Okay.
She has a new phone eh. That's why Oppo.
Okay.
Si baby
Sige.
siya.
Thank you. Bye-bye.
Bye.